Hi, my name is Debbie Reynolds. I'm going to be your nurse today. I have to do a healthcare assessment with you, if that's okay.
That's fine.
How are you feeling today?
Pretty good.
Good. And your name is?
Hope right?
And can you tell me your birthday?
12/27/96.
Do you mind if I sit down?
Nope, not at all.
Thank you. So, some of the questions I'm going to ask you, if they seem too personal, you can say that you'd rather not answer that. You're not forced to answer any questions you don't want to answer, okay?
Okay.
First, are you experiencing any illness today? Do you have any symptoms?
Nope.
Okay. Can you tell me about your past medical history?
I don't really have any. I did just have a baby, and I have poor vision. That's all.
Oh, awesome. How old's your baby?
He's 8 months.
Aw, that's so sweet. Do you breastfeed?
Yes.
Okay. And do you take any medications?
I take prenatal vitamins, but that's all.
Oh, okay. Can you tell me about your family history? We're going to go back to your grandparents on your mother's side. And what I mean by that is, like, does anybody have any cardiac disease, meaning something wrong with their heart or their lungs or cancer in your family?
There's history of hypertension.
Okay. And who had that?
My mother and my grandmother.
Okay. And we're going to do the same thing, but this time we're going to do your father's side of the family.
My father's side, there's nothing that I know of.
Oh, that's pretty awesome. Pretty healthy people then, huh?
Mm-hmm.
That's great. Let's talk about you a little bit. What does your usual daily meal consist of? Like, do you eat 3 meals a day? Do you...
It's more like 2 a day, depending on the day. I usually eat like scrambled eggs and potatoes for breakfast, and then for lunch, I don't always eat like a full meal. Usually just like a peanut butter sandwich or like a banana.
Okay.
And then dinner, I usually have like chicken or like something with some kind of meat.
Okay. Do you snack?
Yeah, I snack a lot. Not usually very healthy snacks, but
For example?
like some candy or granola bars a lot.
Okay. Granola bars aren't too bad. Candy? Everybody deserves a piece of chocolate once in a while, though, right?
Yeah.
Are you allergic to anything? And if you are, what happens when that allergy?
Not that I know of.
Oh, okay. That's awesome. Have you had any surgeries at all? None at all? What are your activities during your week? Do you have a certain exercise routine?
I usually work about 5 days a week, but when I'm off, like 2 to 3 days, I try to take a walk around the neighborhood, do like some core exercises. And that's all.
Tell me about your sleep pattern.
I usually go to sleep around like 9:30, and then I'll wake up at 5 with an alarm, but I wake up kind of tired sometimes because the baby wakes up. I have to feed him. I don't always sleep through the night.
Okay. Do you get a chance to nap to make up for that sleep?
Not usually.
Okay. Maybe it'll get better as he gets a little bit older. Sleep all night for you.
Hopefully.
You already told me that you had some vision problems. Do you have blurred vision now, or is it corrected with your glasses?
No,
Or...
it's fine with my glasses.
Okay. Do you have any dizziness or shortness of breath, or...
No, sometimes I get a headache, but I think it's just from wearing my glasses too much.
Okay. And how about when you're active, like when you go for the walks and things like that? Do you ever have any wheezing?
No.
Okay. Does your heart ever feel like it's racing? Any chest pain?
No.
Okay. Do you have any swelling anywhere on your body?
No.
When you eat, we were talking about you eat granola bars and things like that, and when you go to swallow, do you have any difficulty with swallowing?
Not normally.
Any certain foods?
I don't think so, no.
Okay. Everyone has different bowel habits. What is your normal bowel regimen?
Not very often and not very fun.
Okay. Can you explain that to me?
Usually, like, if I have to go, like, I can feel that I need to, but I just can't. And then when I do, I just can't, like, finish going. And it takes about, like, 3 days for me to be able to, like, completely feel, like, relief.
So you have trouble with constipation, so that's
A lot.
good. Do you ever take any medicine for it?
No, I've taken mineral oil before, like when I was younger, but I don't really like to take it. I don't feel like it helps that much.
Okay. And how about increasing maybe fiber in your diet?
I haven't really tried. I feel like I have like a decent amount of fiber though, but
Okay.
I guess not.
Drinking a lot of fluids would probably help you too with
Yeah,
that.
I don't drink very much.
Maybe if you tried to do that, it would help you with that. Of course, you told me you have a child. He's 8 months old. Congratulations. And what is his name?
Al-Qaeda.
Oh, that's different. That's a pretty awesome name. Tell me, do you plan on having any more children soon, or?
Not soon.
Okay. Are you in any kind of family planning?
I think I'd like to have one more, like 3 years or so.
Okay. So, are you taking anything to stop you from becoming
I'm
pregnant?
on birth control. I have the next one on. in my arm.
Oh, okay. Now tell me about your menstrual cycle.
Well, right now I don't get my period.
Oh, okay. Is that something that happens with having that
Yeah.
implant?
They said it happens like for some people. Like if you have a heavy period, you might still get it, but mine was never very heavy, so I don't get it at all.
Okay. When you go to urinate, do you ever have any burning sensation or any difficulty or
No.
discomfort?
Nope.
Can you describe the color of your urine and if it has any odor to it?
It goes between like clear and then a little yellowish.
Okay. That's good. That means that you're pretty well hydrated. When your urine becomes dark, then you probably should drink more fluids, just so you know. What do you like to do for fun?
I like to watch movies and spend time outside, play with my baby. I like to dance, listen to music.
Ah, nice. You dance?
Yeah.
Oh, that's awesome. Do you did you do it professionally or?
I used to train like really hard and like go away for summer camps and stuff, but I haven't since I've had the baby.
Oh, okay. That's understandable. He keeps you busy, huh?
No.
Have you ever smoked? And how many packs? No. No smoking. Good. How about alcohol? Do you consume any alcohol?
No.
Have you used any recreational drugs? Or are you using any? No. Okay. Tell me about any struggles you're having financially.
Money is a little tight, but I mean, I just started working again, so that's really cool. Having my own money. Nice.
Yeah. And you work at?
I work at Panera Bread.
Okay. And what do you do there?
I'm a dining room associate, so I get to make all the coffee and the teas and just help
Okay.
people take their dishes and all
mingle?
that good stuff. Yeah, mingle. I definitely mingle.
That sounds like a fun job.
It is.
Not too much stress.
No, it's not too bad.
Okay, good. How about your cultural practices? What I mean by that is like everyone has maybe a certain religion or a certain different thing that they practice. Do you have anything in particular?
Not really. I mean, every once in a while when I'm feeling down, I'll like pray or just like think like, oh, please help me with this. But
Okay.
I don't really follow any religion very closely.
Okay. Do you have any needs for a sense of safety? Do you feel safe in your home, in your surroundings?
Yeah.
Everything like that is okay?
Yeah, I have a good family.
You do?
Yeah. we're
And
pretty
your
close.
support system is, who all supports you and helps you?
My mom, my grandmother, my aunt, my boyfriend, my cousins. We're all pretty tight.
Good. And your environment's safe and you have any needs? Do you feel like?
No.
Alright. Do you have any plans on furthering your education?
I'm gonna start college in the spring.
Awesome.